Am I suitable for all-on-X treatment? Hi, I'm Dr. Ash, I'm an implant surgeon, and I'm here to answer your biggest questions on missing teeth and dental implants. As a dentist, our priority is always to try and save and keep your natural teeth. With all-on-X treatment becoming very, very popular, there is sometimes a risk that people are going to start taking out teeth, healthy teeth, willy-nilly, without the proper thought involved. So my first question would be, is what your starting point is. And if we look at somebody's arch, an arch is either the top or the bottom. An adult should have 16 teeth, which includes the 2 wisdom teeth. For the sake of this discussion, if we remove the wisdom teeth, you're left with 14 teeth, okay? Now, the way I look at it and how I plan to assess our patients is anybody who has got 5 or less teeth, healthy teeth, that have got a good prognosis. So I need to explain this. What do I mean by a good prognosis? I mean a tooth that I think will be there in a healthy state for at least 5 years, okay? So if you've got 5 or less teeth, healthy teeth with a good prognosis, then for me, as a surgeon, I need to have a discussion with you about full mouth implants, because I think it's potentially a better idea to sacrifice some of those teeth to be able to build you a more complete smile, more functional, without having to compromise and work around it. If you've got 9 or more teeth that are healthy, then for me, all-on-X treatment is an inappropriate discussion. Your surgeon should just not even be looking at that. You should be talking about how you can individually save those teeth and work around them. So you're then left with the grey area, which is 6, 7 or 8 teeth. And I think this very much depends on external factors. Can you open your mouth for long enough? What's your general health like? Are there any bite issues? And I think I would leave that to the surgeon. But generally speaking, the key thing here is to make sure that your surgeon is got a good working knowledge of complex treatments and that they can use a methodical approach to determine whether you are a suitable candidate or not. Sometimes a lot of people come in who have got perfectly healthy teeth, they want all of them out and put implants in. For me, that's an absolute no. I think we've got to stick to what we believe in, and that is looking after patients' teeth. Okay, so hopefully that was helpful. If so, like our page and subscribe, and I'll see you on the next video.